Statistics show prostate cancer develops more often in black men, and when it does, the men tend to be younger. A Lancaster County man was aware of that information and took the right steps to make sure he stayed healthy. Here's Denon Harris's journey. 51-year-old Denon Harris's days of hitting the pavement started when he was a teen.
I ran cross country, indoor track, outdoor track, and I ran all throughout high school. I had a cousin who actually was a distance runner, and I started running because of him.
Denon decided to do the extra miles too. Now he has several marathons under his belt.
When I'm out basically running or walking, it's just a mind-clearing experience. It's like I leave everything out there in the streets when I'm walking or running.
A time to clear his thoughts, but there's one thought he'll never forget, a conversation with his family doctor.
The 1 year that I went to my primary care physician, I basically said to her, should I be getting screened for prostate cancer at this point?
Denon was in his mid-40s at the time.
Everything felt fine, everything felt normal, and there were no issues. But what she was going to do is for the next time I came to an appointment, she would do blood work and include a PSA.
From that point, Denon's family doctor checked his PSA. The 1 year it was elevated.
At that time, it had went into the mid-7s. And so when I went back to her, she said, okay, what I'm gonna do is I'm gonna send you to an oncologist for a biopsy.
Denon had 7 out of 12 biopsies were positive, so over half of the different areas that we sampled had evidence of cancer.
I was in shock just because of the fact that I never really thought about cancer in that sense.
It is a scary thing. Ooh. Sorry.
Dr. Rahman gave Denon and Lisa some reassurance.
Thankfully, his biopsies were all coming in on the lower end of the aggressiveness spectrum. So he had a lot of areas, but thankfully we had caught it and identified it at a phase where it was still not the aggressive kind, which bodes well for long-term treatment and hopefully cure.
He basically said to me, you're young and you have several options. There's several things that can be done. He said, but the good thing is that you're young.
Denon had 3 treatment options: surveillance, radiation, or surgery.
Let's just do the prostatectomy. Let's do the radical. Let's remove it. If it's going to increase my chances of, living a long, fulfilling life, and I don't have to worry about this happening again and the cancer spreading or what have you.
He loves life. He wasn't gonna let life get him down. He has a zeal to live. And so whatever he wanted, I was gonna support him, whatever that was. And that's what I did. I supported him 100%.
Surgery was scheduled for July of 2020.
From a surgical point of view, he did really well. It was a robotic surgery, so a minimally invasive approach to remove the prostate. Obviously, in a young patient like him, we want to not only remove the prostate, but we want to make sure that we preserve all the continence mechanisms so that he doesn't have incontinence or leakage after the procedure, and then also preserve the nerves that control sexual function.
I felt no pain at all. It healed up the way that Dr. Rahman said it was going to heal up.
It has, and it's a very seamless process. I couldn't be more thrilled with Dr. Rahman and the work that he's done for him.
Denon spent a night in the hospital and quickly moved into recovery mode.
I started walking my usual route because we would walk like a 2 or 3 mile route. And at first, I could probably only do anywhere from a half a mile to a mile, but I would push it a little more every day because I could feel that I was getting a little stronger.
Strong enough to do distance runs again.
I'm feeling, better than I have in years. No complaints at all.
I think he's doing excellent. His energy is back. He is somebody who loves life, and he wasn't going to let this get him down. Ooh, here I go again. I'm just very proud of him.
Danon had no family history of prostate cancer, so this came as a real shock to him and his wife. And as Danon had mentioned, he is running again. In fact, this weekend he is running in a 10K race in Virginia. We wish him, of course, the very best.